So we promised two quick case studies. The first one we're going to cover is a very large provider. So we won't mention the name. Over 2,000 locations. This is really a massive organization, and they're a conglomeration of a lot of acquisitions that have taken place over a long period of time. So we talked about that M&A activity that we've seen in the healthcare space and how it plays out and what impact it has on IT. Certainly that was an issue for them. They had these disparate locations, disparate groups with different IT teams that all had their own idea of how it gets done and what those UC templates and builds should look like. And so, they were launching new hospitals, new clinics, and they wanted really more control from the central IT team while giving flexibility to the local or regional teams that were managing those particular locations or sites. So it's a hard balance, frankly. So you want control centrally from IT. You want to make sure that this is something that can get replicated and you can deliver with speed to the organization generally, but you want to provide flexibility to the groups as much as you can. So ultimately, they wanted a single platform. You're going to hear some themes that we've talked about. So single platform to be able to do all of that. They really wanted to standardize on a set of builds. And so what they ended up doing was, providing a number set of builds, but it was limited to some degree. I mean, it wasn't infinite the way that the UC templates could be set up for different users or for different common area devices. It was really well thought out in terms of how they did it. And then they wanted to be able to securely delegate and use role-based access control so they could allow that work to be done by others, but have it done securely. So what ended up happening is they now have a highly standardized platform to roll out and expand. So when a new clinic is going up or a new hospital is being raised or what have you, they're able to move very, very quickly. They've reduced their times. Not only the time it takes for a particular user, Jeff mentioned 15 minutes. We're seeing even longer in the case of these two case studies. It's more like 30 minutes was the old standard, and now it's well under a minute. But they're able to do it all in a centralized, organized way. The other thing that's happened is they've just reduced errors. A number of errors that used to happen routinely, you can imagine, now that it's automated, now that it's more templatized, those errors are all gone. So that's one case study we wanted to provide. And Jeff, I think I'm going to hand it to you to kind of show what this looks like in the Kurmi tool.
Sure. So just real quickly, we've kind of talked about how do we actually provision a user, and we've also talked really kind of being on a single screen. So it will be one of those things. We want to make things as simple as we possibly can to make sure that we're really going to be able to have to be able to actually get a user onboarded. But we want to make sure we can actually do this cross-platform as well. So it's going to be as simple as, because we've already built all the automation in the background, that you're going to actually see this be able to move through. We're going to do something as simple as click on users. These would have already been entered into Entra ID. They're automatically discovered. We see where they're all at. You can see we actually have Cisco users, Teams users, hybrid users that are in both platforms at one time. And then, but we're also going to have one who's just been added in Entra ID, a brand new user. You can see basically they've already got everything in there. We already know their department. We already know that they are added into Microsoft. But now instead, we want to actually make sure that they can get a Cisco desk phone with a Microsoft Teams soft client as well. So in this case, we're going to go ahead and we see that we've already added in their device information complete with MAC address. We've already got their line has been assigned. But in this case, if you don't like that particular number, we can also, if you don't like that number, red ones are already in use. Green has already is available to you. This will be shared across all the logins. No more spreadsheets. So you have all these numbers also automatically be discovered out of either your call manager or out of Teams Admin Center. And it would also work for DIDs as well as technical extensions as well if you're still using extensions through Call Manager as well. But then also kind of switching back over to Teams now that we've actually got this as a soft phone. You can see the line is actually going to be the same, but we've also added in all the information for an audio codes SBC as well. So you've now just taken 3 separate systems and been able to actually add them all in. Now we can see the users actually had their number added and all the services are actually been called out to automatically from all those various systems, all from Kurmi, and you've just done this very, very quickly. So next thing, I actually kind of switch gears just a little bit, and actually, because that's how you'd actually provision a knowledge worker. But one of the most common use cases we also see heavily in especially in a hospital setting, nurses stations. And so it'll actually be, you're going to have these shared devices, and even if it is also just knowledge workers, you're going to have these shared devices that actually pop up everywhere that will also need to be used as well. And this is also, it's a different process. It's a little bit more lengthy, even on if you're using your legacy systems to be able to actually do this. So instead, we're actually going to be able to do is I'm going to show you how we actually will just create these from scratch, a little bit different because these are devices and not necessarily users, but we already have one created. We're just going to add one just very simply because again, we've already built the templates in the background. We're going to just really quickly and actually say where it's actually going to be going. We're going to say it actually goes into one of the hospitals. We're going to just actually give it a name. I think we'll just call it Nurses Station. We already had one created, so we'll just call it Nurses Station number 2. We already know that because we're just going to automatically activate the codes. We've already got their MAC addresses already been assigned. We've already got we'll have a line assigned to it for the public line that's going to be coming in, and that's all it takes. Far faster. So that's really, and now we have a second one that's already been added. It will be automatically again called out to call manager in this case, added that device, and make sure that you will actually have those added in there as well.